to ask off the top. Is anyone in the room comfortable with bingo? Has anyone played bingo in the past and they know bingo? Would anyone like to participate in a bingo exam here? Okay, very good, thank you. I have 6 different bingo cards. The bingo cards have numbers on them ranging essentially from 1 to 47. And I'm going to ask you please to silently think of any number from 1 to 47. Do not tell me what it is. And I'm going to ask, if you will, in fact, if you want to whisper it to your colleagues left and right, you may whisper the word to the number to them. I will turn around so I do not hear the number that you're whispering to them, and I will actually continue to talk and make noise so I cannot hear your whispering. And once you're ready, if you'll please say, I am ready.
I am ready.
Excellent, because now I'm going to ask, do you see your number, and please take your time, anywhere on that card?
No.
Okay, and don't tell me what your number is. Do you see your number anywhere on that card?
Yes.
Okay. Do you see your number anywhere on that card?
No.
Okay. Do you see your number anywhere on that card?
Yes.
Okay. Do you see your number anywhere on that card?
No.
And do you see your number anywhere on that card?
Yes.
Okay. Please remember your number. And the 3 of you have it. Yes? Okay. Because now what I'm going to do we have about 4 or 5 minutes? Is that okay? Okay. I'm sorry. I have many books. We won't use them all. If time permitted, we would. We won't. One of them, have we ever used this book before? Danielle Steele's nephew, David Steele, wrote Fatal Sins. The single greatest fatal sin we want to avoid is failure to obtain informed consent. It's the reason I have this book, because it works well. We will hurry. If I may, does someone have a comfort level with his or her vision who would like to do something with this book? Is that okay? May I hand this book out to someone? All right, very good. Joe, I'm going to hand you the book. I'm going to ask you, please, to tell us how many pages are in that book. And you may turn to the back. You need not be psychic. You can tell us how many pages are in the book. 280. I'm going to ask you all to allow me, please, the poetic license to say 300 pages. It will make the math easier. In a standard galley proof of a hardback book published in the United States, there are approximately 200 to 400 words per page. 300 pages, 400 words, about 120,000 words. I'm going to ask you all, please, to open the book to any page you want. And if you turn to a page and you say, oh, gee, I don't really like this page, then turn to another page. That's all right. However, once you have the page with which you feel comfortable, I'm going to ask you in a moment to silently scan down that page for a word. Now, please, for today's purposes, I'm going to ask you to select the biggest word, the longest word, the most letters, the most syllables. The reason being, it will make this the most impressive. Now, if you find yourself conflicted between 2 words, you may select 2 words silently. And once you've found your 1 or 2 words, I'm going to ask you please to show it to colleagues next to you so they will be aware of it as well. And then I'm going to ask you please to close the book, remember the words, and I'll have you send the book back to me. Very good. Thank you. Now, do we have 2 more minutes to use another book or 2, or should we hold there? Because I think you all have something to go to directly from here. Oh, okay, another book. Okay, that's all right. Thanks. Here's what we can do. Dare we use a dictionary? Have we ever used the dictionary before in the classroom? We did. We won't use the dictionary. We'll just use a couple of books here. How's this? A Christmas Carol. I have that from Holidays. If I may, I'm just going to ask you to say stop on any page. I'm going to have you please look at the first word at the top of that page. Got it? Just remember it. And And how about Death Wish, my hero Charles Bronson, who starred in all the Death Wish movies. There were so many. I think the last one was Death Wish meets Rocky Beneath the Planet of the Apes, something like that. If I may, I'm going to ask you just to say stop at any time. I'm going to ask you please to look at the first word at the top of that page. Just want you to memorize it. I cannot see it. You have it. Very good. We have a lot of words floating around in numbers. And I'm going to ask, a word was selected, or was it two words? One word. Out of 120,000 words, you selected one word. I'm going to ask you, please, not to tell us your word. I'm going to ask you just to share out loud the first letter of your word.
Letter V.
V is in Victor. The first letter is a V. And I appreciate that. And in fact, letter V, the unconscious mind goes to a word that has meaning. When I was younger, V stood for peace, and it used to be Victory, Winston Churchill. Now I think it stands for the phone company that I actually utilize. And I'm glad, because when I'm driving down the road, I know if people have their phone turned off, they just give me half the sign. Maybe it's my driving. When we are making a chart up for a patient, first time we see them, a piece of information goes into the medical chart. We put it down. The next time we see them, another piece of information goes in. And you see, the unconscious mind goes to a word that has meaning because it reminds us that a medical chart is a living tale about a patient's life. And the first letter that goes in may be the V. And the next letter that goes in may be an I. And then the next time we see them, it may be a D, and an E, and an O. Out of 120,000 words, you see, you all unconsciously selected a word that reminds us that we are creating a living, moving, photographic movie of our patients' lives in the chart. Because if I'm correct, please let me know. The word that I'm receiving from you is VIDEOCASSETTE, video cassette. Is that correct? And you were thinking of a word that you selected at random from the book, and it reminds me that when patients ask us a question, we want to answer them. We want to answer them to the best of our medical knowledge. And there may be times we don't have a clear-cut answer. We may actually have to tell them, we will check on that. Research doesn't have a direct answer, and we may have to answer them PERHAPS, perhaps. Is that right?
That's right.
And sometimes when patients come to us, they may not know if they are coming or going. Is that right? Yes. And you all selected a number totally at random. Totally at random. And the number that you thought of reminds us when we are obtaining labs, lab values are critical. And when you get a number back, you have to have the reference range to go with it. Because you need to know if the number that comes to you is an appropriate number or out of reference range. And the number you all were thinking of, if I am right, please let me know, was 37.
Yep.
Is that right? Thank you all again for the opportunity.